Yeah, I'm here to present an abstract on a study that we conducted at the Ocean Road Cancer Institute regarding thyroid function post-supraclavicular lymph node irradiation in patients with breast cancer. So I'll be making this presentation as part of the team, but also on behalf of the lead author, who is Dr. Rubagumya Fidel. He's not able to make it today. So just as a brief background, several presenters have already mentioned that breast cancer remains to be the most common cancer that is seen in women worldwide and also in Africa. In East Africa, it is also noted that it only comes second to cervical cancer. Now, with regard to irradiation, supraclavicular irradiation post-modified mastectomy is a crucial component of breast cancer management because it is noted to improve local control and also overall survival. However, this is also noted to be associated with adverse effects, including thyroid dysfunction. And the motivation to conduct the study was that these thyroid dysfunction is usually underreported. So basically, the aim of the study was to evaluate radiation-induced thyroid gland functional changes following treatment of supraclavicular lymph nodes in breast cancer patients. With regards to the methods that we used, this was a prospective descriptive study of patients with breast cancer who are recruited and followed up from May 1st, 2017 to 30th May 2018 at Ocean Road Cancer Institute. And we used descriptive statistics to calculate the patient demographics and disease characteristics. In order for us to also have the ultimate assessment of the thyroid function, what we did was to take a baseline and 3-monthly post-treatment thyroid function, then documented and compared with the values. So at 3-monthly intervals up until 9 months, the values were collected and then compared with the baseline to help detect whether there was any dysfunction, okay? And our definition of hypothyroidism in this case, as we may, most of us be aware, was taken to be an elevated TSH and a reduction in the functional T4 and T3 values. So with regard to what we found, we have 2 tables here. So on the first table, there is a column showing the test that was conducted at baseline, the value that was detected at baseline, then at 3 months, at 6 months, and at 9 months. So what we noted is that the TSH value was elevated compared to the baseline. That is at 3 months, at 6 months, and at 9 months. And the second table down there shows how significant those differences were. That is the p-values. And as we can see, at 3 months, the p-value that we had there was 0.04, 6 months, 0.002, all of which we took to be significant since we're using the value of a p-value of less than 0.05 as our significance level. Then also, with regard to the functional T3 and T4 values, what we noted, as I've highlighted in blue, there wasn't a significant deviation from the baseline value for the T4 and the T3 values at 3 months. However, we noted that there was a reduction in the T3 and T4 values at 6 and 9 months. That is as compared to the baseline. And the p-values were also significant for both T4 and T3 at 6 months and at 9 months. One other thing that I have to point out at this moment is that at Ocean Road Cancer Institute, we are currently, the results that we are actually showing here were based on the 2D treatment that is currently on offer. Of course, there are plans to install the 3D, but this is basing on the 2D treatment that we currently have there. So what did we conclude from the results? Now, having stated that we defined our hypothyroidism, or hypothyroidism in this case, as an elevated TSH and a reduction in the function of T3 and T4, the laboratory values in this case showed us that there was subclinical hypothyroidism in 10% of the patients. And as it was hypothesized, there was actually a trend towards subclinical hypothyroidism. And what we picked from this is that there is need to routinely evaluate thyroid function in patients who are treated with radiation to the supraclavicular region. One more thing that I can also add in this case is that as we are transitioning to the 3D at Ocean Road, it will also be important to see what the trends will be when we have to offer the same modality. In other words, we can probably conduct studies that can help us to see whether we have a similar picture. But this is essentially what we found out from the brief study that was conducted. Thank you. Yes.
Thank you for a very good presentation and finding. I just wanted to know, is there any of the patients who had a significant decrease of the disease before that necessitated the thyroid? Is there any one of your patients who did that? Because these are, of course,
Yeah.
what the clinical part.
Yeah.
Because it was prospective study.
Yeah, it was. So one of the limitations that I think we had in the study is that it wasn't long enough to probably follow up and determine whether these patients will have ultimately needed treatment. But for the patients, for those patients that we realized had the features of hypothyroidism, they did not really require treatment. Okay, so I think maybe if we had a longer time to follow up the patients, we'll have probably known whether they will have required treatment, or not. Yes. Cobalt 60. Yeah. But there are plans, I think. Yeah. Sorry.
Positioning of the patient's head. Sometimes they find it a bit uncomfortable if your cobalt has already decayed. So long treatment time, and then they have to position the head in a way when you're treating the supraclav. In my center, we make sure that the patient's head is tilted to the other direction. And then some of them may not find it very comfortable, and then they may move. Afterwards, we start, we've not done this study, but once we realize some of them may start reporting of sore throat. But then we told them that any changes, they should let us know quickly. So when they start reporting of sore throat, then we start looking in that direction. But then mostly, we have seen that the position of the head sometimes is a bit of a challenge. And then if the surgery too restricts the movement of the arms, that one too becomes a bit of a challenge. So that's why I'm asking that.
Okay.
Do you position your head in that way, or your head is made straight?
Well, I think.
The head is usually tilted on the other side, and we try to exclude the spine. But as you say, definitely the time, as treatment, definitely most of the time, sometimes they
Okay. First, the study was done irrespective of the stages. There were different, in fact, just because of the time constraints, we were not able to project everything. But majority of the patients were actually stage 3. With regard to the liver function, for this particular study, we did not conduct the baseline liver function, but probably it's an idea that we can incorporate in maybe a future study. Yeah. 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 Yeah, we can. Exactly. I know the records are there. We can be able to trace and also include that in the study. Yeah. Okay.